Adedipo Adetuyi, a quintessential gentleman, symbol of integrity, certified pharmacist, seasoned and visionary entrepreneur, versatile project management expert, team player and industry leader, is the founder, managing director and chief executive officer of Oakleaf Pharmaceuticals Limited, a fast-rising world-class healthcare support solutions provider in Nigeria and one of the most distinguished CEOs to look out for in 2025.
Oakleaf Pharmaceutical was established in 2012, so give or take we're about 13 years old now, and we're into the importation and distribution of pharmaceutical products, finished goods into the country. And for the last 13 years, we've been able to expand our portfolio into now about 22 different products. We also have a footprint in different parts of the country, and we're looking at expanding into other parts of West Africa and even other parts of the world as well. And one of the other things that we also do beyond selling pharmaceutical products, which our focus is basically on vitamins and supplements, is also to equip the populace with enough information about the benefits of living a healthy lifestyle. So we organize events, we organize situations whereby people can come in and keep fit and get their vitals checked, blood pressure tests, sugar level tests, cholesterol tests and stuff like that. So we would like to see ourselves as a holistic healthcare company, not just someone that sells pharmaceutical products. And our vision basically is to continue to consolidate our position as a value-driven healthcare company. And so just to elaborate on that a bit, one of the major points of that is the fact that we are customer-centric, we are patient-focused. So our vision basically ensures that we focus on the patients as opposed to focus on the medication. So we want to ensure that patients that use our products or patients that interact with us in one way or the other come out better off than they were before they met us. Then our mission basically is to help to reduce the incidence of non-communicable diseases. So basically it goes like to help to reduce the incidence of non-communicable diseases and improve the quality of life of all people. So our mission basically ensures that non-communicable diseases like hypertension, diabetes, cancers and all that, we are able to eradicate them or bring them to a very, very minimal level. And by giving people the right attitudes about the kind of lifestyle to live. So when it comes to lifestyle, I'm talking about eating healthy, working out, having a very healthy disposition towards life in general, because mental health is also something that people need to have a good disposition towards life. And so we express that by holding seminars, webinars, events that also help to, like I said, inform people and educate people about how they can live a very healthy lifestyle. So that's basically what our mission and vision is. But in terms of how far we've gone, I think that the burden of non-communicable diseases in Nigeria today is very, very large. In fact, every day, it seems to be getting worse, especially when it comes to sudden deaths, like people dying from strokes, people dying from cardiac arrest, people dying from high blood pressure and the likes. And so for us, the onus is very, very strong for us to really push and see how we can help to reduce the burden of that disease, of those diseases, because it's becoming endemic, and it's something that for us, we are looking at other ways, innovative ways, dynamic ways to address that situation. So one of the major services that we render is obviously the sale of vitamins and supplements, and that's our major focus. But beyond that, I'd like to also say that we focus a lot on also education. So education, like I said earlier, we also have webinars that we do. We also organize events, basically to sensitize the public and sensitize the populace about the benefits of living a healthy lifestyle. I think the health sector in Nigeria, if you look at where we're coming from, I think definitely there's been a lot of improvements. However, that's not to say that there isn't room for more improvement. There's a lot of room for improvement. There's a lot of things that we as stakeholders in the health sector can also do. I don't like to push everything on government all the time. However, in this case, government has a lot of role to play to support and equip and ensure that the healthcare sector in Nigeria goes stronger and stronger. We are the largest population of black people on earth, and still healthcare is a major factor that is not still sorted out. A lot of people still pay out of pockets for medications. A lot of people still travel out of the country to get access to good healthcare, which thereby puts a burden on our foreign exchange, for instance. So there needs to be more there's a lot more that can be done, and I feel like the government can also do so much more to ensure that the healthcare sector in Nigeria grows to the capacity that it can. I think that the NHIS has come a long way as well. It was established in Nigeria, definitely has come a long way. I think on the back of the NHIS is the HMOs who have come as well, and I've also sort of HMO. I see it as a type of health insurance. So when it comes to the NHIS itself, I think that there's a lot that can be done. There's a lot of the access. A lot of people still don't have access to health insurance in Nigeria today. I think at the last check is about 2 to 5% of people in Nigeria have access, which is very, very, very poor. So I think that when it comes to the NHIS, there's a lot more that can be done. I think recently they were mandated, or most employers were mandated to ensure that every member of staff in the organization was insured, from health. Of course, we also do that here as well. But one of the major things I feel like is the informal sector. The informal sector, a lot of them don't have health insurance. A lot of them don't have access to health insurance. So that's something that that's a big lacuna that needs to be breached, because if that's not breached, you find out that most of the people in Nigeria today are sort of at the bottom of the pyramid, and those are the people that are not having that access to health insurance, and those are the people that need it the most. So in my own opinion, yes, health insurance has come a long way, but there's still a lot more that needs to be done to ensure that everybody is covered under the health insurance scheme. So HMOs have also come along they've done a good job. I've subscribed to HMO myself, and I think that the services are quite good. I think at the beginning there were issues with a lot of hospitals not wanting to get them on board, or a lot of hospitals prioritizing out-of-pocket patients over people that came under the HMO. But I think that rhetoric is changing gradually, and I think we'll get there. But the HMOs, definitely, there are a few of them that are doing very fantastic work, and I think that they need to be encouraged to ensure that the spread and the reach and the coverage is also wider to more Nigerians. I don't agree that foreign drugs are better than locally manufactured drugs, because there's a lot of industries, a lot of companies that are doing very well when it comes to locally manufactured products. The challenge I'm having is that a lot of the time we don't have the capacity to manufacture in Nigeria today. So when it comes to like for like, you take the anti-malaria that is available in India and the anti-malaria in Nigeria that is manufactured in Nigeria, I think you find out that they are about the same in terms of quality. However, we don't have the capacity to produce certain medications, which I think that we need to develop the capacity to do that. If you can count on your thumb the amount of WHO certified industrial plants in Nigeria today, there are not many. So there needs to be more. I know that we have the likes of the big manufacturers, the big pharmaceutical companies that are doing that and doing it very well, but there needs to be more people coming into that space and doing more, and there needs to be more competitiveness and more security in terms of being able to manufacture our own products. We need to get there, but we are not there yet. But in terms of quality, I think that it's at par for the ones that we can produce. Okay, so NAFDAC is currently at war with fake drugs, which is a type of corruption, and corruption, as they say, is fighting back. So in terms of winning the war, I think that yes, they are doing quite well, but there's a lot more that needs to be done, because the war on drugs is the war against unnecessary deaths. It's the war against people having to put their hard-earned money to buy medications, and at the end of the day they are not efficacious, or they don't work because someone somewhere has decided to be greedy or wants to make a lot of money from it. So I think the war on drugs, or the war on fake drugs, is not something that NAFDAC alone should handle. It's something that all of us should be involved with. So when it comes to certification, when it comes to registration, when it comes to all the value chains that is involved in bringing in products and getting them registered in Nigeria and getting them certified, there needs to be a whole lot more that needs to be done. But currently, I would say that NAFDAC is doing their bit, but there's a lot that needs to be done. There's a lot. So I wouldn't say they are winning the war right now, but the war is going on, is ongoing, and the people that are benefiting from the fake drugs are fighting back. But NAFDAC needs to be very resolute, and I commend the management, the leadership of NAFDAC for the job. Currently, I think there's a lot going on in that regard, but a lot more needs to be done. So again, I think it still comes back to the issue of the fact that we don't manufacture a lot of our products here. About 80 to 90% of the products of the pharmaceutical products that we use in Nigeria today are imported from India, from China, and from other parts of the world. So it's important that if we want to achieve drug sustainability, we need to, reduce the cost of drugs, we need to be able to produce our own drugs in Nigeria. We need to be able to produce at least the essential medicines. Malaria is a disease that is endemic to Nigeria today. There are not many manufacturing companies that are manufacturing anti-malaria drugs today. You know, so things like analgesics, paracetamol, ibuprofen, and stuff like that. There needs to be more support. The government also needs to do a lot more to ensure that there's an enabling environment for manufacturers to come in and do their work. When it comes to electricity, power supply, when it comes to access to finance, when it comes to the ease of regulations or the ease of registration, those things are things that affect and will continue to increase the cost of drugs. So, but primarily, an easy way out will be to ensure that we are producing our drugs locally instead of depending so much on importation. Okay, so the PCN, I think, is a wonderful group. I belong to that group, and I think that they've done very well to promote and support our pharmacists, especially within our space, and also ensure that we are bound as professionals to a very, very high standard and high ethics. So yes, they've done a fantastic job. They are continuing to do a fantastic job in terms of advocacy, in terms of supporting a pharmacist and ensuring that we are able to work within the Nigerian space and not be disturbed too much. So yes, they're doing a fantastic job. Last year, at the December period, we were able to give out certain, let me use the word palliatives to, certain underserved members of society, underprivileged people, and every now and again we also do that. We organize events, we organize outreaches, events whereby we give back. So giving back, it could be drugs, it could be food, and stuff like that. So these are kind of the things that we do as well. Okay, so I think one of the major things I will go back to is people above everything, and getting the right people and making them understand the vision and mission of the organization and what we are set to achieve. So making them understand that it goes beyond us, or it goes beyond what we want to benefit or what we want to see in terms of, oh, we have this sales or we will make this amount of money. It has to be about the people. So the people within the organization understand fully our vision and mission, and I think that motivates them to really go out there and strive to achieve what that mission and vision is and achieve our objectives. But beyond that, I also like to say that innovation and excellence is also one of our core values. And so when in everything that we do, we like to go put that foot forward and innovate and be excellent in everything that we do. So I think those three things are some of the things that have made us quite successful in the last few years. So in the next 5 years, well, I don't have a particular picture that I paint, but I think that for us, as long as we are moving the needle as it pertains to our vision and mission, which is to reduce the incidence of non-communicable diseases, then that would be a perfect period for us. So for us, it's not really about, oh, we want to have this, we want to have that. It's about, are we able to achieve, how far have we gone in achieving our values and our vision and mission. I think that for me is the major thing, and we strive towards that every day by day, and God help us. And one of the major things that is required for success is resilience. So you have to be very resilient, you have to be very dogged, you have to be very dynamic. And I think I'll prioritize people. You have to be able to attract good people and equip them with the knowledge and capacity to do the objectives that they are set out to do. So I think for me, in a nutshell, these are the major things that I think are required for success in the Nigerian business space. My name is Pharm Adedipo Adetuyi. I'm the founder and CEO of Oakley Pharmaceuticals Limited. I've been an MD for about over 12 years now, and it's a pleasure to be here. And thank you very much for this great honor. And it's an opportunity to also talk to everybody. So thank you very much for that.